Hi, this is It's Gonna Be Okay with Dr. Roseann, and we're gonna be talking about autism myths. Despite autism just being on the rise, it is probably, other than just anxiety in general, the single greatest thing I've seen in 3 decades. Just this rise in autism, and everyone always wants to know, like, is it because we're getting better at diagnosis or whatever? No, we're not getting better at diagnosis. In fact, I think it's quite the opposite. I think that as we have so many more kids with autism, we're missing so many of them. And these myths get in the way of kids with autism getting help. I mean, in the last couple of weeks, I've had, I think, 3 or 4 kids fly in with autism, and they're all parents who really saw the signs early and just jumped into the deep end and really started to work on all those holistic components, diet, looking at their mitochondrial issues and the different genetic components, and using we like to call biohacking, right? Getting into biology and using what we know through science to improve their brain and body and really help to get them, support. And they wouldn't have done it if they didn't know what autism is. And it wasn't an easy road. And the A word is scary, but we know that it's 1 in 27 boys today, 1 in 44 overall. And they're estimating that by 2031, it's going to be 1 in 27 births overall. And, so it's not, it's not as uncommon as people think. If you're looking for more natural solutions, go over to drroseann.com/group. It's our free Facebook group where we talk about all the different ways to change the brain, because you are in charge. You have the power. And that's where we dive into it. So feel free to join us. So let's talk about these myths, because I got a bunch of them and I want to get through them. So number one, only boys have autism. Now, you just heard me talk about that stat. Clearly, more boys have it, right? And let me tell you a little secret. Boys get more easily diagnosed because they tend to have coordination issues. And so those coordination issues are more observable, where girls tend to have less of that. And the greater the coordination issue, the greater the severity of difficulties that they'll have throughout their life in general. We know this, of course, through research, right? Some good research came out a couple of years ago that talked about the visual centers of their brain start overgrowing at 6 months, and they can't turn off the information coming in. So they are noticeable differences in males and females, right? Okay. So people with autism are antisocial, also very much full of baloney, right? So many people with autism, some people don't with autism. I had this kid come in this year and he was like, I seriously am thinking about maybe jail would be a good opportunity for me because I would not be with other people. And I was like, let's rethink that, my friend. I don't think that's a great choice. And you have many skills and you're very bright. And you might be with people you really don't like for a long time. So, it was this true story. I'm not joking. I can't make these stuff up. These are the great stories that I get to share with you. So, some people really are uncomfortable, don't like people, and have zero interest, but the majority of individuals with autism do. They're just not skilled at connecting. So they might avoid because they've been rebuffed, right? So if you see your child trying to connect, and maybe somebody has said that they're on the spectrum, probably they're not. You haven't been told that, because I find that people are so inept at it in diagnosing. And don't look for your schools to be amazing at it unless your kid's got a glaring, issue. And in these early stages, we'll talk about, when kids get diagnosed. But unless they do, they're not going to really know. So, okay. So autism is a childhood condition. No, does not end in childhood. It's a lifelong condition. You're a neurodivergent. It's like a brain that sees things differently. An autism brain isn't all bad. The brain of an autistic just sees things differently, and it doesn't end. Okay. So people with autism don't feel emotions. Well, that's not true, right? But it is something that we hear a lot. They may not show the same range of emotions because their interpretation of them is different. Also, they may be missing things. So they may not perceive a situation in the same way, so they're not going to react in the same way. But yes, they have a range of emotions. Yes, they feel them. Some autistics feel emotions more strongly. So for sure. Okay. Gastrointestinal issues aren't common for those with autism. That is a big, big myth. That is one of the most common things we see. And in fact, when the American Academy of Pediatrics, when they finally updated the guidelines after 12 years of not updating them, and the rates of autism went through the roof. I mean, it was ridiculous. They finally admitted, this is a very common issue. So I've never had an autistic that doesn't have gastrointestinal issues in their history, typically constipation. And that's typically because low tone is a big factor in autism. And so the colon is not going to work the same, right? And these kids go on Miralax and all other stuff. Okay. People with autism can't, make eye contact, right? So, or if you don't make eye contact, you have autism. If you don't make eye contact, it doesn't mean you have autism. And some kids with autism do make eye contact, but it is more common not to make eye contact, but also kids with sensory processing don't make eye contact a lot. So, and yes, many kids with autism have sensory processing, but many kids with sensory processing don't have autism. So it's not a guarantee, and never force somebody to make eye contact. It's the worst. Okay. Autism results from bad parenting. That is such an old myth. It's not even funny. It doesn't really deserve a lot from me other than saying this is not caused from bad parenting. It's definitely not. Okay. We know that. All autistics are like Rain Man. No. Yes. Are there some people that have unbelievable gifts? Have I had many kids are like, "What's your birthday?" And I tell them, and they're like, "You were born on a Monday." Yeah. Or have such an affinity or a knowledge for sports statistics or random things. Yes. Those can be splinter skills. It doesn't mean that they are capable of everything. Okay. People with autism can't form relationships. That's just not true. Again, outside of the family home, some autistics struggle. And some of that is because of the lack of predictability, or the person, they just don't know what to expect out of the person. The other person really isn't um, talking to them in their language, so they kind of don't have that reciprocal component. So they pull away, right? Autism is a disease. It's not a contagion, people, as much as people want to think of that. It is something that is a different brain. It is not highly inheritable. And as we learn more and more about it, the brains of autistics, 76% through postmortem studies, have incredible amounts of inflammation. So a lot of reasons, we're not going to go into it, but for sure, it's not a contagious disease. Okay, people with autism are either geniuses or intellectually disabled. Those are the two ends of autism. We call it autism spectrum disorder. So a lot of kids do have very high IQs. A lot of kids have lower IQs, but actually the majority of people are mid functioning, and have a range of IQs from, borderline IQs, your intellectual capability. So certainly a lot of parents who have the high IQ kids are like, well, they're only a little autistic. You're not a little autistic. It's how impaired are you? And social is always the unifying theme. It's the degree of difficulty that you have. Children with autism are typically diagnosed by age 2. That is a no, 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 no. Unless you're really impaired and you're showing some of those big symptoms, coordination, no eye contact, lack of reciprocal play, no not engaging, no smiling, no interest in others. Most people are not diagnosed. And if you've ever heard me tell the story, I diagnosed somebody who was 62 years old, who was classic autistic, classic. And so gifted and so beautiful in so many ways, but classic high IQ intellect, and also got in trouble all the time for not, putting the filter on it. Okay. There is a medication for autism. Why in the world are we medically constraining kids with autism? Can we say that again? Why are we just medicating our kids with autism, right? There is no medication for autism. There's not one that's approved. And yet, so many kids are medicated. Yeah, there's a lot of comorbid things like anxiety, OCD, irritation and anger. But we're here talking about natural solutions, right? We can give our kids magnesium. They're often struggling with amino acids and need things like GABA or L-theanine. I mean, you have to look at genetics. I super recommend looking at your genetic profile. I just got one this week. And we knew there were mitochondrial issues. We knew there was low tone. We knew there was detoxification issues. But wow, you got the whole profile that tells you which supplements you should have, which foods you shouldn't have. And that was done through their provider, their medical provider. It was really pretty cool. And we were able to get to creative about what could possibly help them. So the biggest fallacy is that integrative therapies can't help autism. That is baloney and cheese. And I have always said that my greatest struggles or the most complex brains I ever have when I do those beautiful QEEGs are autistics. My greatest successes have been with autistics. I work with a lot of autistics that have PANS and PANDAS at the same time. So there are many things that can be done when you have autism that can support the body in healing itself, addressing some of those secondary things that come, like the gastrointestinal, all that, from distress to improper elimination, as well as having so many components that really can help with things like anxiety and depression. And we use PEMF, our COM-PEMF device, specifically with autistics to help regulate their nervous system, support detoxification. I already mentioned magnesium. I think everybody should be on magnesium. Ours is coming out. So make sure you get on our wait list because it's going to be amazing. Only one time ever special super deal discount and specials that come for you. But there are a lot of things, including neurofeedback, if I didn't already say that, doing counseling. Some people like ABA and need it. Some people it's controversial. You can do what's best for you, but there is some times that it really can be helpful. But social skills training, really important. And just like anything else, you got to calm the brain, come in with behavioral support so there can be new learning. And social is so gray that it needs a lot of support for our autistics to really thrive. It's important for them because we are a social world. And, we want our kids of all ages to be successful. It's never too late. But I see that one of the greatest failures, is that nobody's telling parents to keep the social skills support and really don't let your foot off the gas, because there's always challenges along the way that even our neurotypicals face. So lots of myths about autism. If you feel that your child might be autistic, they're typically labeled as ADHD, and they're showing, real indifference to things that you're trying to motivate them with. They are low motivation. They're not connecting the dots. They struggle socially, and they don't understand what's behind it. So our ADD kids socially are very impulsive, but understand. Our autistics don't really understand. You've got to scratch the surface and listen a little bit more and pay attention a little bit more. Then go to an expert in autism. And if you can, that would be somebody privately. Schools only assess if you need special services or not. They're not really there diagnostically. And if you really want to get the proper help, you want to check under the hood. And if you're looking to get support from me and you want diagnostic support, you can go to drroseann.com/help. That brain map is life-changing for so many, and it really can set you on the path to the right solutions at the right time.